All right, doctor. So I'll fire off with the questions that I've received so far. And in between, if any of our participants have any questions, feel free to drop it in the chat and I'll read it out loud once I'm done with the questions that I already have. Okay. So let's start off with the very, very basics. What is cancer?
I think it's important to know. So cancer is basically uncontrolled growth of any tumor, any cell in the body. So all our body is made up of number of cells, and each of those cells is programmed to do a certain job and die after a given period of time. But due to various reasons, most probably due to genetic changes that occur within the cell, some cells lose this control. So what happens is that after they are generated, they continue to rapidly grow and divide and add more cells and not die off as previously planned. So then what happens there is that around that cell, other cells usually perform their normal function and they die off at the programmed time. But these cells continue to grow. So that's how you will feel a tumor, maybe in the breast, maybe in the thyroid gland, maybe inside the mouth. That's why you will feel like a lump or a tumor because they continue to grow in an uncontrolled manner. So that's basically is a cancer. So what happens then after a cancer comes into existence, it tries to spread to the other side. So how it happens is first it grows on that site itself, invading the nearby structures. So if it's if it starts in the lung, it might invade the heart or the big vessels that is quite close to the lungs, or it might invade the ribs, which are again just next to the lungs. This is by direct expansion of the tumor. But then what happens after some time is the cancer cells can get into the bloodstream or the lymphatic stream. And when you get into one of those, the blood or the lymphatic stream, along blood circulation, it can spread to a distant site. So that is why then a breast cancer can spread to the lungs, or a breast cancer can spread to the brain. A bone cancer can spread to the lungs. So how it spreads to a distant site is through the bloodstream or through the lymphatics. So the only cancer cells can spread like that. Normal cells or any other cells which are found in the body cannot be generated from one side, go through the bloodstream to another side, and then get deposited there, and then start growing at that distant site. So that's the main difference between cancer cells and the normal cells.
So even during your explanation of cancer, you mentioned a few cancers that are known to us, like breast cancer. So can you please explain what's the difference between like the cancers you've explained and pediatric cancer? Like, why do we have a special category called pediatric cancer? Is it just because it's, the patients of this cancer are young? Why the distinction?
Yeah, that's an important question. So definitely there is a big difference. So first of all, pediatric cancers in Sri Lanka are defined as cancers that occur in children less than 19 years of age. So this cutoff is kind of arbitrary and it differs from country to country. In some countries, it's something like 12 to 14 years, but some countries it goes on to 24 years. But whatever the age group you get, there is a big difference between those cancers that occur in this age group and the cancers that occur in older children, let's say 50 to 60 years old. So the biggest difference is the types of cancers you see. In adults, the cancers you mainly see are what we call that are arising from the epithelial layer or the outer layers of the body. So they are the breast cancer, lung cancer. So commonest cancer in Sri Lanka in females is the breast cancer. in males is the cancers that occur in the mouth, and number 2 is lung cancer in both groups. So in pediatrics, what you see is what the cancers that arise from the middle and the inner layer when during the embryonal stage. So we call them non-epithelial cell cancers. So the commonest cancer in children is leukemia. If you take in adults, that's like the 4th or 5th or maybe even the 6th commonest cancer. So the types of cancer, we can discuss what are the other cancers that that are seen in children, but the main big difference is the type of cancer is different. And the other thing is adult cancers usually occur because of some risk factors. And most often these risk factors are preventable. So what are the risk factors? Lung cancer occurs due to smoking. You can get cancers around the mouth and the rest of the oral cavity due to betel chewing. Obesity can lead to ovarian cancer, endometrial cancer, and several other cancers. So there is identifiable risk factors. So for a significant component of these adult cancers, because if you take away those risk factors, if you stop smoking, you can reduce the chance of lung cancer occurring in you by at least by 50 to 60%. If we stop betel chewing, oral cancer risk goes down by around 80%. So likewise, there are identifiable risk factors that causes cancer in adults. But in children, usually there are no identifiable risk factors as such. They occur due to random chance. So in pediatrics, you really don't talk about preventing cancer. You can't do anything from susceptible children from developing a cancer. So in adult cancer treatment, prevention is a big part of it, but pediatrics, it's not that much. Another big difference is now pediatric cancers are highly curable. So we say that roughly about 70% of all pediatric cancers can be completely cured. So I'm talking about complete cure here, not just achieving remission. So then we know that if you cure those children, then if they are like 15, 16 years old, they have another 40, 50 years to live after the cancer is cured. So we always have to, when we design our treatment regimes and when we decide how we want to treat them, we have to keep in mind, we not only want to get rid of their cancer, but we have to minimize long-term toxicity. This is because we don't want to get the cancer cured, but leave them in a non-functional state, or if they are like only bed-bound, or they have many other serious side effects, so that their quality of life is impacted. So how we treat children are quite different. So we always try to think of, we know that their growth is a big thing. So some things like radiotherapy can hurt growth. So as much as possible, we try to prevent giving radiotherapy to sensitive areas. Fertility. So the ability for them to have children later on is again very important. So we know that some medicines can impair their fertility. So we try not to use them as much as possible. So these problems are not seen if you are treating a, let's say, 70-year-old lady with breast cancer. You are not worried about fertility. You are not worried about growing tall and gaining height. So those are, we in pediatrics especially, we have to think of minimizing their long-term side effects as much as possible. Another possible difference is pediatric cancers. Usually there is something called cancer predisposing families. Because of their genetic makeup, their families have a hereditary risk of developing a cancer. So in adult cancer, we see this in breast cancer, cancers of the intestines, sometimes ovarian cancers and things like that. But pediatrics in children, usually these cancer families don't develop cancers during their pediatric age group when they are very young. They develop it only later on. So this genetic predisposition also is mainly seen in adult cancers. So there's a big difference between the adult and pediatric cancers. You shouldn't think that pediatric cancers is just the younger version or the smaller version of adult cancers. It is biologically, it is very different. Another, as I said before, pediatric cancers, the chance of a cure of a pediatric cancers is very high, because it's the makeup of that is such that it responds to chemotherapy and even sometimes radiotherapy more than adults. So as I said before, we generally consider pediatric cancer cure rates to be around 70%. Adult cancers, it's around 30% when you take all cancers altogether. So that curability is, and the prognosis is much better in pediatric cancers. So yeah, so those are some of the differences you would see.
So can you explain to us like the types of pediatric cancers that are known to mankind so far? And also, can you let me know if there are like types of pediatric cancers that are unique just to children? Because when you discuss adult cancers, breast cancer, yes, it happens in men, but it's like more likely in women than men. So do we have any type of cancer like that for children, or how does it work?
Yeah, so if I go to answer your first question, so the commonest pediatric cancer is cancers arising from the blood, what we call leukemia. So that makes up almost 50% of all cancers diagnosed in children. So there are different subtypes of leukemias as well, but the out of those also the commonest subtype is called the B acute lymphoblastic leukemia. But that's a cancer that is very curable, especially in selected patients. So the commonest cancer by far is leukemia. But then if you take the other cancers, if you go down the line, as a group, the commonest solid tumor. So the leukemia is a blood cancer. All of the others arise from solid organs. So we call them solid tumors. So if you take away the leukemia, next, as a group, the commonest cancers are brain tumors. So the brain tumors, also there are different categories: gliomas, medulloblastoma, ependymoma. But when you bunch them all together, it is responsible for about 25% of 20% of rest of the cancers. And then if you go down, whatever the organ there is, you can have a cancer. In the eyes, there is a layer called the retinal layer, and there is a cancer rising from that called retinoblastoma. In the lymph nodes, there is lymph nodes can get affected, and it is called lymphoma. And in the stomach, from the liver, you can get liver cancers. It's called hepatoblastoma. So this is different from adult cancers of the liver, which are called hepatocellular carcinoma. And hepatoblastomas are almost exclusively seen in children below 6 years of age. And then from the kidneys, you can get nephroblastoma. So again, this is different from the usual adult kidneys. Adults get something called a renal cell carcinoma. So this is again totally different. How you treat it is different. The chemotherapy medicines you use are different, and the cure rates are much higher than adult kidney tumors. So and then you can get there is an adrenal gland neuroblastoma. So again, that's something predominantly seen in children, and if you can see it in adults as well, but it's not very common in adults. And then if you go on for your limbs, from the bones, there are multiple bone tumors such as osteosarcoma, Ewing sarcoma, So those are usually not limited to children. They are seen in, they start off after puberty, during adolescent period when you are 13, 14, 15 years. But Ewing sarcoma and osteosarcoma can be seen in people in their 20s, 30s, 40s, and even later beyond. So that is not something that is unique to children. Then you can get tumors from the muscles layers of the body as well. Again, this is something we see in adults as well, and they are called rhabdomyosarcoma. So there are multiple, whatever the organ in the body, and most of the time you can get a cancer, but some are more common than others. And some cancers are seen only in children, at least majority of the time in children, and some are basically seen in children and adults as well.
So I have received a question saying, how do you identify pediatric cancer? Is it normally seen in the form of a lump on the body, or how does it go?
Yeah, so how you identify them all depends on it depends on what the type of cancer you are looking for. So things like leukemia, they basically they present as fever which is not responding to any sort of usual treatment, ongoing fever, low-grade fevers going on for weeks. Sometimes you get for 5-6 days and then there is no fever. Then again, you might get fever, things like that. You might get body pains, especially in the long bones because of the leukemias. And then you can get, because when there is a leukemia, your other blood components such as platelets will be less. So when platelets are low, you can get bleeding from your gums, when you're brushing teeth and things like that. Or you can get red patches on your body. So multiple complaints you can see in patients getting leukemia. But if you see more solid tumor signs, it's usually by detecting a mass or a swelling of an organ. So sometimes things like nephroblastoma, the children are quite well. They don't have any other symptom. So most of the time they are detected as an accidental finding. Mother goes to give a bath to a small child and he suddenly feels a lump in the stomach. So they have so that's how some of the solid tumors are felt. Brain tumors, because of the brain, the tumor can grow within the skull, and it can present as headaches. It can present as early morning vomiting, and if it is at a kind of an aggressive state, which is big, the tumor is big enough, it might cause weakness of your arm or a leg, or it might cause a fit. And then only you would identify that there is something going on and investigate further. So the signs and so bone tumors, again, you will feel it as a lump. They usually associate with some kind of a trauma, whether they might say that you had fallen and hit your leg somewhere, or something has come and stuck your leg. But always it usually starts with pain and as a lump. And very rarely, sometimes they can present with fracture when they have not noticed anything abnormal in their leg, but then all of a sudden there is an unexplained fracture in the body. So that's the presentation can be quite varied, and it will depend on what sort of a tumor that or a cancer that they are having.
Thank you, doctor. So just letting everyone know that we have about 2 minutes left in the Zoom meeting, so please rejoin via the same link. Having said that, can I know if there's has been an increased trend in cancer being identified due to maybe lifestyle changes compared to what was there maybe 20 years ago? Because nowadays a lot of kids consume fast food. There's a lot of access to maybe mobile devices, which I've heard that there's bad radioactive waves. So is there an increased trend in children getting diagnosed with cancer?
Yeah. We'll come to mobile devices later on. But there is a, if you take, so there is a cancer registry maintained by Ministry of Health in Sri Lanka. And if you take the absolute numbers, yes, there is a rising trend. But this rising trend can be explained by, because now our population is increasing as well over time. And also there is cancer detection is much better than before. Because now some people maybe 10, 20, 30 years ago died off due to some condition, but no one could diagnose what they had. But because of the improvements in technology, in medical knowledge, now we can better diagnose most of these diseases. So some of the cancers which would have gone undetected some time back now are detected at a more frequent level. So that might be a reason for the increasing in numbers. But if you take the worldwide, when you consider children's cancers, so there is a rise of about 1%. It's not a massive rise. It's not a really alarming rise to consider, but there is a rise of about 1%. So that could be associated with the environmental factors or the foods we consume or the lifestyle changes that we are. So, but for children, this impact is kind of minimal because the cancer usually occur due to external factors when you are exposed to some of these risk factors for a longer time. Only just a one-off short exposure usually will not cause cancer unless it's massive radiation or something like that. So children haven't lived enough to be exposed to these environmental toxics for them to develop cancers, if you talk in general terms. So the answer to your question is yes, there is an increase in number if you look at the absolute numbers, but it is mostly due to the changes in the population or better detection methods, rather than because of the influence of the environmental changes.
So you mentioned that, yes, we are seeing an increase in the numbers, but again, it's not something that's considerable at the moment. So can you explain to us maybe the new technologies that we have in Sri Lanka, and if not in Sri Lanka, around the world, that is used to detect cancer in children?
So yes, so what we need to keep in mind is that, as I said before, children cancers are quite curable with already available treatment. So at least 72%, 70% to maybe 80% of them can be cured with what we have, the already existing methods. So these existing methods are, I'm talking about treatment, not purely detecting, is surgery for solid tumors, radiotherapy, and chemotherapy. So when with what you have, when you can cure them, there is less incentive to explore other novel methods. But we need to remember that at least 20 to 30% of these children are still not cured. So there is a place to look for, to experiment, to spend money on trying to identify newer methods. So the focus has been on, if you take leukemia, things like leukemia, right now the focus is been not only to increase the cure rates, but to reduce toxicity. Because we know that in the treatment methods we have, there is still significant toxicity. So some of the toxicity means side effects. So some of them are mild, things like the vomiting or the loss of appetite or even hair loss. Because when they are on treatment, it is difficult to see, difficult to, it is can be not a pleasant sight for the parents or the others. But we know that as soon as you stop chemotherapy, the hair starts to grow back. And within like 3 to 6 months, you get the hair as before. And probably sometimes they say even you get thicker hair. So those are not big issues. But the bigger side effects are that the impact it can have on the liver, heart, or the kidneys, or on their growth, on their the IQ because of the brain radiation and things like that. So mainly when we in cancers where we have achieved very high cure rates, now the focus is on maintaining those high cure rates while reducing the side effects of treatment. So that is the people most focusing on right now. But then again, there are, as I said, there are about 30% of these cancers are not curable. And also sometimes when the cancer recurs, when it relapses, when it comes back again, curing them is much, much more difficult. The chance of a cure then goes down drastically. So there has been some focus on how to improve cure rates of those cancers as well. So the latest, one of the latest methods that they are using right now is try to use the body's own immunity to fight against the cancer. So our immune system is built that something is foreign or something outside the body or something different to what we have enters the body, to detect it early and take it out of the system. But what happens is that these cancer cells also can be quite clever and evade this immune system. It can develop various mechanisms so that they are not detected by the body's immune system. But this new technology would do is that technology, what it does is that basically it'll program your body's immune system to identify these cancers and get over those immune evasion that is seen in cancer cells, so that they do their original job of detecting foreign objects and trying to take it out of the body. So that had showed quite a lot of promise. This was started with adults in some of these adult cancers. Now it is more and more used in pediatrics as well. There is something called chimeric antigen receptor tumor. So it basically means that you take the blood out of the body and genetically change that the lymphocytes within the blood and transfuse back. So those lymphocytes can go and fight against cancer. So none of them have been 100% successful, but they are more successful than the available treatment to fight some of the more aggressive type of cancers, which has not been responding to the routine or the orthodox treatment options that we have right now. But unfortunately, these are very, very expensive. And expensive, when I say expensive, it goes to about hundreds of thousands of dollars. So right now, majority of them are not available in Sri Lanka. But so as time goes on, the costs usually come down, and then we can expect them to be available in Sri Lanka as well.
It's definitely interesting to hear about these using the body's own immunity to defeat cancer, because we've heard a lot about, preventing cancer research. People invest a lot of money in cancer research. So it's definitely interesting to see that there has been improvements in technologies to detect cancer and, prevent things before it gets worse. So, you mentioned before that there is no exact way to prevent pediatric cancer. But, in Sri Lankan society, I've heard, people saying, okay, eat this so that you can prevent cancer, or, do this so to reduce the risk of cancer. So where is the truth in all of this, doctor?
No, so what we need to remember is that so what I said was we can't prevent pediatric cancer, so a cancer occurring within this 0 to 19 years of age. But what you eat, whether you lead a sedentary lifestyle or not, or whether you exercise, your lifestyle changes during these 0 to 19 years will impact whether you get a cancer later on in life, when you are in your 30s or 40s or 50s or whatever. So for example, if you start, that it is proven that if you start smoking early, the chances of you getting a lung cancer goes up by significant proportion for every year you start smoking early. If you are obese, if you are like if you are above weight, when you are a teen and beyond, your chances of developing some breast cancer or cancers of the uterus is much higher. Same with lack of exercise, it goes with obesity. And things like junk food. We know that processed meats and all has a direct impact on developing colon cancer. So earlier you start eating them, and the quantity, the bigger the quantity of these processed food that you consume, the higher chance of you developing a cancer. So, but other than that, you can't really prevent pediatric cancers as such within the pediatric age group. But that does not mean that you should start practicing good food habits, good lifestyle changes, and generally a healthy life right from the start.
So another point that you stressed on was the impact on mental health of maybe the patients or maybe the patient's loved ones during the process of treatment, because the cure to cancer is not always an easy road. It's very emotional. People lose hair, they become weak, some become bedridden. So can you explain to us how someone can support maybe a loved one or an actual patient mentally during this process?
Yeah, so I think that's another good question. So they need lots of support. So especially in pediatric cancers, you can imagine the devastation that the parents and the immediate family and maybe the friends go through when a child is diagnosed with cancer. On top of that, the cancer treatment usually is prolonged. It takes about, for leukemia to completely treat a child, it takes about 3 years. And especially during the initial phases, the child has to be kept in hospital. And most of the time, one of the parents has to be with the child. Not most of the time, all the time, one of the parents has to be with the child. So that family can undergo a lot of stresses due to economic issues, childcare for other children, to manage their schooling and other duties, and then and even providing for this child it can take quite a toll on you. I think that is where the society should step in to ease some of this burden, especially immediate family, friends, so that it's not to what they need is not your sympathy, but how to help them to get over this troubled period. So because if for majority of the families, the cancer treatment path ends up with a good result. So it is just that immediate period that you need a lot of support to get over it. If you do that, then the child will be leading a completely normal life later on, and then you can get on with their lives. So then, that's where the family needs support. So also what we need to remember, I think this is improving a lot compared to maybe about a decade ago. Earlier, there was a taboo that even the families didn't want to tell others that their child is diagnosed with a cancer, because there was a stigma attached to the diagnosis of a cancer, and then they would think that they would be ill-treated. But the things have improved quite a bit. I don't think it's a bigger problem as it was some time back. So so as I said, most of these cancers are highly curable, and if the child is cured, they will lead a normal life. So there is nothing to discriminate against them or think too bad of them. They can go to school. The cancers are not infectious. The treatment is not harmful. So if a child who's on treatment in school with your kids, so there is nothing for you to worry about. Because nothing harmful can be transmitted, or you can't catch anything, cancer, just by being with them or hugging them or with close contact. So that's the key thing I think we should remember. to support as much as possible as the parents wish. Some parents might want financial support. Some parents might want maybe the extended family to be with them at that time. So because they have to take care of the other children and things like that. So and remember that there is nothing to discriminate against them and nothing to stigmatize these children, because they are like as other children in every way you can think of.
I have received this question in the chat box. It goes as, is cancer genetic or epigenetic? If cancer is genetic, doesn't epigenetic play a role in cancer?
So cancer is genetic as well as epigenetic. It is very clear that there is genetics at it. So epigenetics is mean the surrounding tissue, which does not code actual gene expressions. So there is no doubt that it is whole exome is involved, and there are different drivers and different mutations of genetic that cause cancers in children and adults.
So connecting back to the initial question that I asked about, some mental health support during this difficult treatment period. So most of the audience here today are Leos, and we have a special place in our movement for pediatric cancer and cancer cure, cancer prevention. So what do you think that we as a movement, as Leos, as young adults can do to help patients during this time? Do you think there's any area that we as a movement should shine light on for cancer?
Yeah, so as children, as young adults, as you said, probably a way that you can help them out is spending more time with them and understanding their problems and designing whatever the program or interventions then you all do by actually knowing the problem and not just doing something for the sake of doing something for children's cancers. Because as you said, so Lions Club Pediatric Cancer is one focused area. So there is a lot of requests from people just to do promotion. They don't really understand the situation, and it is just a one-off thing which is of no benefit for the children or their families. So earlier there was challenges because of the COVID issues. Because we were not having any visitors to any of our ward areas to meet them. But now the things we are relaxing things quite a bit. So there is time for interactions and various things. So earlier we used to have arts and craft classes from volunteers. We used to have coaching classes when the O-levels or the scholarship exams was close by for the children who are in the ward and they can't go home. There were things like musical shows and things like that. So that kind of aspect, but it is always best to work with people who are doing this on a routine basis. So there are several charities located around the cancer hospital who are doing that. If you partner with them, things will be easier for you in terms of logistics and things. But so there is there is a big crisis about medicine shortages. So all of the rest of the support we get from volunteers, we right now direct everything to try to cover these medicine shortages, because all of the others can be considered as luxury. But if you don't have medicines, we can't cure them as we say. Because our outcome will not be that great if you don't have all access to all these medicines. So right now we are mainly concentrating on getting our medicines requirements sorted. But still there is space, there is room for the sort of activities I talked to you about earlier.
So, as the doctor explained, I think I will take a slight moment to promote our club project itself. So we, as the Leo Club of Batramulla Synergy, along with our project chairperson, Leo Pabavi, have been working tirelessly to raise funds to buy essential medications, as well as some treats for these cancer patients at the Apeksha, I think, Cancer Hospital. So I will leave our contact details in the chat if anyone's interested in donating. So moving on from that, so doctor, there was one final question that I have received. What is your message to the society as a doctor, as someone who has seen cancer patients, their recoveries, their stories of strength, and the vulnerabilities that they've shared with you? What is your story?
Yeah, so I think if I want you all to go away with one message from this discussion, is that what you need to remember is childhood cancers are highly curable. So what we need to do is our utmost to ensure that whoever the children who can be cured are cured by providing them with all the facilities possible. So that ranges from medicines, from support to the families, for mental support to get over this period of distress, and even raising awareness about them out in the world so that more people would come in to help them out. So this is not something that only the doctors can do. This is not something only the Ministry of Health can do, because we know that cancer medicines are so expensive, and in these times of economic crisis, the Ministry of Health is struggling to meet those expenses. And it is something that even people from all ages, all socio-economic status, from all races or cultural backgrounds can something that they all can do. So I would ask everyone here, and to take the message out to the rest of the world as well, to band together to help these children achieve that something they can, because we know that some cancers are not curable from the outset, but we are not talking about majority of children doesn't fall into that category. So what we are trying to do is ensure that what is possible, and to limit it anyway because of these other external factors such as medicine shortages.
So, doctor, one final question. So there has been a request for contact details of any volunteer organizations or any doctors that Leos can get in touch with to work more effectively to help these cancer patients. So do you have any resource links or anything that you could share with us right now?
Yeah, so I don't have it to share just right now, but Indira Cancer Trust, they have a Facebook page. So Indira Cancer Trust is something that is working closely with us, and also the Prashasti Foundation. Again, they are having a Facebook page, if you might be able to find out. And another organization that has been working recently is I forget the name, but they go up for right for Apeksha. They are from Australian base, but they have a local group as well. So yeah, so I might be able to send you the links later, but most of these groups can be found on on Facebook, or they might be having websites. So Indira ICT, or the Indira Cancer Trust, is the most active, and they have got the infrastructure going, and they have a partnership with Lions Club, I think 306B or something like that. So on a different project.
All right, doctor. So
If you want to donate medicines and things, you can directly contact the hospital donation unit. So if it's for a medicine donation, it's best to directly contact the hospital donation unit. The hospital number is 112-850-252. And I'll just type it here. And then you can ask for the donation unit.
thank you, doctor. So I think that is all the questions I have received. Is there anyone else who has any questions to direct towards the doctor? Nope. I think that's it then. So thank you so much, Dr. Sanjeewa, for joining with us. I think I'm not sure if it's your only day off or like it's a Sunday. It's a day off for most of us. So thank you so much for joining in. Thank you, Leo Pabavi, for chairing this amazing project. And thank you all our participants for joining with us today. I hope all of you had something to take away from our project. So it's been Danaja. It's been very nice being with you all. Thank you and good night.
Yeah, man, thank you and for Leo Club Tremolo Synergy for organizing this and spreading awareness about childhood cancer in Sri Lanka. Thank you very much.
Thank you.
Bye.